Thank you. My name is Ann Savory, like Jessica mentioned, and I am the Neuroscience Account Manager with SK Life Science here in the state of Washington. Our final speaker of the day will be Dr. Brandy Fureman, who will be speaking on the topic of how to achieve the best outcomes. Dr. Fureman joined the Epilepsy Foundation in 2016 as Vice President for Research and New Therapies and became the Chief Outcomes Officer in 2020. Her main responsibility is to ensure that the Foundation's activities result in better outcomes and quality of life for individuals and families living with the epilepsies. Dr. Fureman coordinates the overall direction of the Mission Outcomes team, composed of public health and education, government relations, and advocacy teams, and the staff of the Wellness Institute and the SUDEP Institute. She also directs the Coordinating Center for the Epilepsy Learning Healthcare System and is a principal investigator in the Human Epilepsy Project, which ensures alignment with the research and innovation team on an ongoing basis. Dr. Fureman previously served with the National Institute of Neurological Disorders and Stroke as a program director in the Channels, Synapses, and Circuits cluster, overseeing a portfolio of basic, translational, and clinical epilepsy research, including clinical trials. She was a Presidential Management Fellow at the NINDS, graduated from Cedar Crest College with a BS in Genetic Engineering Technology, and received her PhD in Neuroscience from the Department of Neuroscience and Anatomy at the Pennsylvania State University College of Medicine. Her research interests focused on molecular and behavioral effects of ion channelopathy and triggers of dysfunction in episodic neurological disorders. Please welcome Dr. Fureman. And I hope I'm pronouncing your name right.
You are, Ann. Thank you so much. And I really want to thank everyone at Epilepsy Foundation Washington for inviting me to talk with you today. It's a real pleasure to be with you. And as you heard, my commitment to epilepsy has been decades long. I started my career almost 20 years ago, and ever since that time have been working to try to figure out how we as a whole system can begin to improve the outcomes of people with epilepsies. So I'm going to share my screen, and hopefully you can see that. I'll go to presentation mode. There we go. Okay, Jessica, does that look good?
It does, yes, perfect.
Okay, great. So we will kick off. And as you heard, I became the Chief Outcomes Officer at the Epilepsy Foundation just this year. And so this is a new position for me. My previous role was in research, and so that was where I was comfortable. My background was in research, my comfort level was in research. And now I'm in a position where I need to think about things beyond the new therapies that we're bringing to market. Those are incredibly important, and we'll talk through some of those opportunities and things to be hopeful about in this talk. But I have the opportunity to step back and try to take a broader lens and look at how do we achieve the best possible outcomes for everybody with epilepsy, both at a population level and at an individual level. And so what I'm going to share with you today is my evolving theory about how we do that as a community, help every one of us to achieve the best possible outcomes. I wanted to give you a little bit of background before I go deep into the talk, and these are some things for you to keep in mind as we're going through this. So a couple things about epilepsy. I'm going to use the word epilepsy a lot in this talk, obviously. But when I say epilepsy, I really mean the epilepsies, because epilepsy is not one thing. It is really a collection of many different kinds of disorders that all share seizures as a common feature. So keep that in mind when you hear me use the word epilepsy. Also, the epilepsies are a spectrum. There are epilepsies that have mild impacts on people's lives, and there are epilepsies that have devastating impacts on people's lives, and everything in between. And we have to keep in mind that our community is all along that spectrum. Finally, epilepsy is more than just seizures. Seizures are critically important, but they are not the only thing that causes burden in people with epilepsy. And so we always have to keep in mind those comorbidities, those co-occurring conditions that can impact lives. I want to say a word about the burdens of epilepsy. And we often say that, epilepsy doesn't discriminate. Anyone can get epilepsy. Anyone with a brain can get epilepsy. And that is true. But the impact of epilepsy can be very different depending on what group you belong to. And so the idea of reaching equity in epilepsy care and treatment and education and programs is something that is very important. Making sure that we are not perpetuating health disparities in epilepsy, and we are actually working against them, working towards the idea of equity for everyone who has epilepsy is important to keep in mind. And then just lastly, a couple things about me. I'm not a medical doctor, and so I'm not going to be able to give you individual advice about your particular situation, but I am someone who has been in the community for about 2 decades, trying to take a broad view of what we are doing that is achieving improvements in people's lives. And so that's where my perspective comes from. Personally, I don't have epilepsy. My kids don't have epilepsy. So I'm not coming at this from a personal motivation. My motivation is really about making a difference for a large group of people. And there's so much opportunity. There's so much reason to be hopeful that we can really make a difference for people with the epilepsies. That's what motivates me. And finally, I want to let you know that my salary support comes solely from the Epilepsy Foundation, and the foundation itself is supported by individual donors, philanthropy, through federal grants like our projects with the Centers for Disease Control and Prevention, and from corporate sponsors. Okay, so let's dive in. What does it take for someone who's diagnosed with one of the epilepsies to live their best life? And how do we make sure that everyone gets that chance? So I'm going to propose a theory, and that theory is that if our goal is to achieve the best outcomes and quality of life for everybody with the epilepsies, then we have to pay attention to 4 different drivers. Key drivers are things that lead to the outcome that you want, the goal. And I'm going to propose today that there are 4 elements that are drivers of the best outcomes and quality of life in epilepsy. The first one is high quality epilepsy care. The second one is availability of community services that go beyond healthcare and start to touch those other areas of life that we know impact people's outcomes, those social determinants of health, if you will. The third area is supportive environments, the opportunity to live and work and learn and play in environments that are safe and supportive for you. And finally, the activation of an individual or a family to take part and take charge of their own healthcare, their own care, their own outcomes in epilepsy. So those are the 4 things that we're going to take a look at, a deeper look at, in terms of how they influence the opportunity to have the best outcome, and how those individual pieces break down. So when we talk about something like high quality care, it's not just the existence of high quality care. It also means that people have to have access to that care. People have to receive care that is best for them. Evidence-based care, the care that we know is the best approach for your particular form of epilepsy. And then finally, especially for those people who are not responding to our current treatments, we have to have new therapy development that contributes to the opportunity for everyone to reach seizure freedom and better seizure control. So those are the secondary drivers that feed into whether high quality care can help lead to the best outcomes. In the community services domain, I think that we need to look deeper into the access to behavioral health programs, some of those things that we know impact those with epilepsy beyond the seizures. We have to look at the availability of assistance programs within the community to assist with transportation, with employment, et cetera. So those are the pieces we're going to dig a little bit further into in terms of community services. We need to look at the places we learn, we work, we play in schools and in employers and in the public space. And how do we make sure that those places are safe for people with epilepsy to move through life? And then finally, what are the individual elements that are required to get to an activated individual and family? So number one is an understanding of epilepsy, what epilepsy is and what it means for you individually. A second area is self-management, having a control of those tools that are going to help you to manage your condition. If it's someone you're caring for, how will you help to take care of the person that you're responsible for? And finally, having self-confidence and activation to become a mover and a driver in your own care and in your own community. And then we're going to take a look at the kinds of things that the foundation is doing to try to achieve these best outcomes on a population-wide level, and also how you can get involved in some of these activities to reach for yourself your own best possible outcomes and best possible quality of life. So let's dig into high quality care. We talked about how there are 3 different elements. And the first element I want to talk about is access to care. Now we know that the ability to get access to high quality epilepsy care is not equal. It's not equally distributed throughout our population at this point. And so one of the programs that we are very proud of and support very strongly is advocacy for access to high quality care. We do that through a grassroots advocacy network. That's a place where you individually can get involved in advocating for these issues. And the themes of our advocacy are around care that should be person-centered. So it should be care that is appropriate for that person. We know every individual with epilepsy is an individual, and the considerations that go into the treatment plan need to be individual considerations. And so we advocate for person-centered care. We also advocate for physician-directed care. And again, that relates back to the idea that there are many epilepsy treatments, but it should be the individual's physician and that person making the decision about which treatment is best for them. And so those are 2 pillars of our access to care advocacy. We also advocate at the federal level for new therapy development and innovations, opportunities to work with the FDA to try to help accelerate new therapies through that pipeline so that we can get them into the hands of people sooner. So I wanted to share this slide because it talks about the good and the bad. I feel like this is a slide that has both good news and bad news in it. The good news is that there are many, many treatments available for the epilepsies. And you can see how over time, the numbers of those treatments has really started to take off. And I have to say this slide is actually out of date because just this year, there were multiple new treatments approved by the FDA, rescue therapies, treatments for resistant focal seizures, treatments for Dravet syndrome, a number of new things coming out on the market. So this treatment landscape is expanding all the time. And that's great because that means every one of these treatments has helped to improve seizure control for a number of people tested in clinical trials and is safe enough to put out onto the market for individuals and their physicians to use. The bad news is, in very few cases do we know which of these treatments is the best to use first, or which of these treatments is the best to use for any individual person. And so we have this wealth of opportunity of treatments and very little knowledge of how to best use them for an individual person. And so I've also touched on this slide about the variations in access to specialty care. For example, we know that surgery for some people can be an incredibly effective procedure. In some cases, it can cure seizures, but that access to surgery is not equally available. We know that African Americans take much longer to get to surgical evaluation and then undergo surgery at lower rates. So those are some of the health disparities that we need to make sure that we're keeping in mind as we advocate for better access for everyone. We know that there is higher mortality in people with epilepsy, and we at this point don't have a way to identify those people who seem to be at the highest risk or any strategies other than better seizure control to try to prevent early mortality in epilepsy, especially epilepsy death due to SUDEP. So the intervention for this issue is one that Jessica, our wonderful Jessica Beach, has been participating in. And I'd invite any of you who are interested to also get involved. There are chances for patients and family partners to be part of this intervention. And the intervention is to test out a new system of delivering healthcare. It's called the Epilepsy Learning Healthcare System. And the goal is to bring together epilepsy providers, healthcare providers, community services partners, patients and families, and researchers together in the same system so that we can begin to learn about outcomes from every patient visit. So there are site teams at epilepsy centers. There are 13 right now all across the country doing this work. They pair up with patients and family partners, either from their center or in the surrounding area, and work together with community partners, groups like Epilepsy Foundation, local offices, and others, rare epilepsy organizations, other epilepsy nonprofit organizations. Hopefully, we will begin to reach out to some other community partners like NAMI or others in the community who also offer important services, and bring them into these site teams to begin to work on improving care for people with epilepsy at that center. In this system, those teams begin to send information to a central registry, and the information includes the types of epilepsy the person may have, some of their social determinants of health, what's their insurance status, what's their educational level, what's their race and ethnicity, and include with that some of their outcomes. What's their seizure control like? What is their quality of life looking like? Are they screened for depression, for anxiety? Are they receiving appropriate care? If, for example, they're a woman with epilepsy who's looking to get pregnant, have they made sure that there are important pieces of education that they've shared with that woman? Those kinds of information go into the registry. And within the registry then, we can bring together information from many centers across the country and learn what is working best for which types of patients. And also important, what is not working and what should we not be putting into our treatment regimens because we know we have evidence that it's not going to be helpful for these types of people. So that is the Epilepsy Learning Healthcare System. It's a quality improvement network that operates on the premise that when we all work together and we learn continuously, we're going to be able to improve outcomes for all people with epilepsy. So when we look then for interventions that are not working for people, we have to next look at how to develop therapies that do help to improve seizure control for those who are not controlled with any of our currently available therapies. And the intervention here that the Foundation has very proudly supported for many years is our research and innovation programs. Now, we have decided that it is important for the Foundation to play a central role in convening the regulators, the clinical trial developers, the individuals from industry, and patients and family members to talk about what do our priorities for therapy development need to be. Every year, we bring those groups together in a research roundtable to try to tease out better ways to get new therapies for epilepsy to the market faster. We also have decided that having a way for people in the community to understand what are the currently available treatment options and what are the things that are coming through the pipeline is an important service for us to provide. And so you see here on the slide this little graphic that shows what we call our pipeline tracker. This is a spot on epilepsy.com where you can go in and search for new therapies that are in development for your particular type of epilepsy or the epilepsies you're interested in. We also have invested in research ourselves in order to change the paradigm for people with epilepsy. And so here I'm showing you the graphic for My Seizure Gauge. This is an initiative to try to cut down on the uncertainty that's associated with living with epilepsy. The My Seizure Gauge project is designed to try to create a system that can be used through wearables, through external signals that can help predict or forecast the likelihood of a seizure for an individual person with epilepsy. And that team is finishing up their 3rd year of work. They've made great progress, and we have really high hopes for the results that they'll be able to share in what they've learned about how to forecast someone's likelihood of having a seizure on any particular day. We have for many years supported new therapy commercialization grants. And here I'm showing you just a few over the years that have reached widespread use in the market. The new therapy commercialization grants are just one part of the epilepsy therapy project. The other part is something called the Shark Tank competition. And this is a competition in which we encourage innovators, entrepreneurs, people with epilepsy, their family members to come forward with new ideas about interventions that could help improve life for people with epilepsy. It's a competition we run every year, usually at our Pipeline conference. And we make awards based on a panel of sharks and an audience choice award. So that's an exceptionally fun event to take part in. And I encourage you to look for the notices for that. That will be coming up again soon. Finally, in the area of preventing SUDEP and identifying biomarkers that can help us recognize when an individual is at high risk of SUDEP, we've offered the SUDEP Challenge. And this was a series of prizes that we award for individuals or teams who have begun the work of developing a predictive biomarker for SUDEP. We are at the very last stage of this competition, and we are reviewing applications right now for the final prize. And I hope that we will be able to make a very important announcement about a winning solution soon. So we've dug into the ideas around high quality care and how these things contribute to improving outcomes for people. Next, I want to turn to the idea of community services and the availability of community services to help improve lives. We're going to talk specifically about some of the behavioral programs that have been developed by the Managing Epilepsy Well Network. Now, this is a group you may not have heard of, but they are actually, as you can see here, epilepsy centers all across the country who are working together to develop behavioral interventions for people with epilepsy. And they tackle things like memory issues, depression, self-management, learning how to take control of your condition and optimize your treatment and care. There are a number of these programs, and you can see them listed here. Some of them are offered through Epilepsy Foundation offices, and we'll talk more about one of those toward the end. But this kind of effort, this work to develop strategies that are non-medical strategies, they're behavioral strategies, is an important piece of improving outcomes for people with epilepsy. We also look to efforts like our Wellness Institute at the Epilepsy Foundation to really look at the whole person and the system in which that person operates to see how we can make improvements that then improve outcome. And as part of that community services piece and really a strong public health system for epilepsies, we have to have information and support available to people in the community. And so one that I wanted to mention here is the 24/7 helpline for epilepsy. You can reach it at any time, any day, any night, and it's available in English or in Spanish to help direct you to the resources that you need when you need them. I wanted to mention also that the SUDEP Institute offers education and bereavement support for anyone who has lost because of epilepsy, for any cause. This is an important service that we believe is necessary to offer to our community until we get to the day when we can prevent SUDEP. So now I'm going to turn to the idea of supportive environments, the notion that people with epilepsy should be able to move through their environment and feel safe and feel supported. And here, there are opportunities for you to get involved as well, always opportunities to get involved. We've developed something that we're calling the Seizure Safe Nation. And this is an effort that really was started by an advocate, a young woman from Kentucky who believed that her school nurse and her teachers and her coaches and the bus drivers and the cafeteria workers, everyone should have the education needed to help in the event of a seizure at school. And so that really motivated the Seizure Safe Schools movement. And as you can see here, there are now multiple states across the country that have passed legislation to require that their personnel, their school nurses, school personnel, receive training in supporting students with seizures. And so we're really incredibly proud that so far we have begun to train thousands and thousands of people who are now better equipped to keep their students safe in their schools. This is a place where you can get involved. There is seizure first aid certification available. These are online courses that Jess has been one of our most wonderful instructors in those courses. And it will teach you the things you need to know to recognize different types of seizures and how to help. The 3 S's, stay, safe, side. It's a simple message, and we can spread this message among our community and beyond our community so that individuals can be safe wherever they go, wherever they live, wherever they work, wherever they go to school. I also wanted to mention the idea of opportunities to enhance employment for people with epilepsy. Approximately 30% of adults with epilepsy are unable to work. And so supporting the idea of employment, job creation is really pivotal. And we are building, with the help of a new Robert Wood Johnson Foundation grant, an epilepsy employment and empowerment program, which will be coming soon. We have for many years and continue to support the Jeannie Carpenter Epilepsy Legal Defense Fund. And I think many of you are aware of the incredible history of the Epilepsy Foundation with the Americans for Disabilities Act. The 30-year anniversary was just very recently, and we are incredibly grateful for the advocacy that went into that legislation. Okay, finally, I want to talk a little bit about the role of individual and family activation in getting to best outcomes for epilepsy. I will propose that it is important for you or your family to begin to understand your epilepsy. And when I say that, I don't mean that you need to become a neuroscientist and you don't need to learn how to read EEGs. I can't do that. But you do need to be able to begin to understand enough about your particular situation that you can ask questions of your doctor. And we have some suggestions on this Knowledge is Power brochure. There are some questions that you can take to your physician, your healthcare provider, to get better information about your care. One of the things that is important to know is, what seizure type do I have? And you'd be surprised, many people don't know what their seizure type is, or they may be mistaken about what it is. The reason that this is important is because different treatments work for different seizure types. And so this is really an important feature of your epilepsy to have diagnosed correctly. The second is that there can be different epilepsy types. Again, important in determining what treatment should look like. And finally, I'm going to move us over here to this column, the etiology column. This is one that people have not talked about nearly as much as seizure type or epilepsy type or even epilepsy syndrome. Etiology is the underlying reason that you have epilepsy. Now, in the past, etiology has not been as important because our treatments didn't differentiate. Our treatments really worked based on your seizure type or your syndrome type. But what we're learning in the new therapies that are being developed is that etiology, knowing what is the reason for your individual epilepsy, can help derive brand new, precise treatments that work on that etiology. And so I'm just going to give you one example. You see here, there are many different etiologies of epilepsy. You might have epilepsy because you had an infection in the brain. You might have epilepsy because you had an immune reaction in the brain. Your epilepsy might be unknown. About half of people with epilepsy have an unknown etiology. But I believe that that is changing. And that is one of the things that is going to take us into a new era of treatment for people with epilepsy. So I'm going to dive a little bit deeper into this idea of genetic epilepsy. And I'll show you this slide, not to go into each and every one of these genes, its variants, or what the cause, the ultimate mechanism of epilepsy arising from that is, but simply to show you how dramatically over time our understanding of the genes that play a role in developing epilepsy has grown. So if you were diagnosed with epilepsy way back in 1997, we'll use that as an example, there were very few genes that were known to play a role in epilepsy. And so the idea of genetic epilepsy applied to a very small number of people. But look at where we are today. And this slide is also out of date. We're ending at 2015. And my gosh, there's been an even further explosion in the number of genes or gene variants that have been now associated with epilepsy. What this means is we now have a much better understanding of individual opportunities for treatment that directly impact the outcomes of these particular gene variants. And so if you were diagnosed in 1997 and you didn't think that you had a genetic epilepsy, you know what? In 2020, the answer may be very different. And so that's one of the reasons why, as a person with epilepsy, as a family living with epilepsy, you want to have some level of awareness of the changing treatment landscape, because what wasn't an answer for you in the past might be an answer now or in the very near future. And so that's one reason I think it's important to begin to understand your particular epilepsy. The other place that individuals and families can really begin to take action and get involved is in a program like PACES, Learning Self-Management for Epilepsy. And the program of active consumer engagement in self-management in epilepsy is one that is offered by the Epilepsy Foundation of Washington. Jess is one of the co-facilitators for that program. It can help to teach you those skills so that you can begin to take better control of your care. Again, this was a program developed in the Managing Epilepsy Well network, and actually was developed at the University of Washington by two folks who continue to grow and expand this program and are also now testing in Spanish, which is fantastic. Again, we need to make these programs available to everyone. I also wanted to list here one example. This is a tool that comes from the Epilepsy Learning Healthcare System. And the tool is a screening tool to look for barriers that get in the way of taking medication. Adherence to your treatment regimen is one of the best ways that you can maintain seizure control. And yet it has not been a place where we have very actively intervened. So we've looked at how can we make sure that individuals are having a conversation with their healthcare providers about the things that get in the way of taking their medication. So this screening tool helps to identify those issues, and then there are resources that will go along with any of those barriers that are endorsed by someone who's taking this screening tool. Using tools like this, tracking your seizure activity and writing it down, recording it, whether you use paper, whether you use an electronic seizure diary, whether you use an Excel spreadsheet, that's an important piece of your care and becoming an active participant in your care. There are tools for tracking seizures available on epilepsy.com. Having a seizure action plan and having that plan available to individuals who will be working with you or working with your child is an important part of taking active control and making sure that you or your child are in a safe environment. Those kinds of tools are available, and you can make use of them to improve your chances of having better outcomes. So I hope that having gone through all of this, I've given you a framework of the things that I believe really contribute to the best possible outcomes and quality of life for all people with epilepsies. Those are high quality care, access to community services, having supportive environments, and an activated individual and family. And we've talked through some of the programs at the foundation that we are using as interventions to make sure that we are driving towards better outcomes for the entire population. And I've tried to bring out some opportunities where you as an individual can take action for these pieces to try to reach a better outcome for you, your child, your loved one. But I haven't mentioned the most important thing in this entire system. And I believe that the most important thing in this entire system is really you and your willingness to become part of a movement to make sure that we can make these features available to everyone. We are not going to get high quality care, community services, supportive environments, and activated people and families simply because it's the right thing to do. We will get those things because our entire community of people and families living with epilepsy say, we know we can have better outcomes. We know that's possible for everyone, and we are willing to join the movement and work to make that happen. So you are the most important piece of this whole equation. I want to end with a story. This little boy is Nihi, and Nihi started to have seizures. His seizures were not controlled by medications. And so his parents got connected with their local epilepsy foundation. The foundation connected them to an epilepsy center that offered an advanced treatment, the ketogenic diet. On the ketogenic diet, Nihi's seizures went away. And today he's seizure free. And that's an amazing story. And we celebrate that and we hope for that for everyone in our community. We know that right now it's not possible. But together, we can make that vision a possibility for everyone with epilepsy. If you begin to participate, if you begin to work together towards that shared future. So I want to thank you, and I'm happy to answer any questions if folks have them.
We have had a few, Brandy. Thank you for that very much. To start off, our first question is, where can one find out more about joining the epilepsy healthcare system program in general?
Oh, absolutely. The first stop I would suggest to you is to talk to Jessica Veach, who knows this system inside and out. She's actually helped to develop some of the tools that I showed you today. So Jess can be one of your first contacts. And you can also go on the website at epilepsy.com/ELHS to find out more information.
Excellent. Thank you for that. Moving forward, you mentioned a few things about physician-directed care. How would that affect the role of nurse practitioners in care with people with epilepsy in general as well?
Oh, that's a great question. And I by no means meant to diminish the role that nurses, nurse practitioners, advanced practice providers offer in treatment for people with epilepsy. I use the term physician-directed care to show the difference between care that the physician or the healthcare practitioner, advanced practice provider, nurse practitioner is recommending for that individual person versus something like step therapy, which is an invention of some insurance companies where you must fail certain medications before they will approve another level of coverage. So that's the distinction between the healthcare provider directing what care should look like and something like an insurance company directing that care.
Excellent. Thank you very much for that. Our last question is very good. What is the role of social workers in the treatment and support of people with epilepsy? Possibly, is there a key contact from that field or maybe a couple with whom to discuss that role and engagement with that would be proper to mention?
Yeah, we have been very impressed by the roles that social workers play in making sure that people with epilepsy can connect to the right resources that are going to support them in their particular situation. We've begun working with different partner organizations, and the Managing Epilepsy Well is one of those partner organizations that offers these programs that can be delivered by social workers. And we're always looking to develop new partnerships. And so if there is a group that, that we should be talking to, I would love to get that information. You know, we're never finished. And the more people we can bring to the movement, the better off we will be. And I think social workers are a very important part of that equation.
Completely agree. Thank you for that, Brandy. We do have a couple more moving forward, just 2 questions left. How would one find out more about the Shark Tank Epilepsy Invention Contest?
Oh, great question. So we do have information available on our website, epilepsy.com/research. We'll take you to the research pages where there are descriptions of the contest itself, the eligibility criteria. If you have an idea that you want to bring forward, you can read there about how to do that. And then we also have a wonderful staff of research team members who are willing to talk to you about ideas and explain the competition as well. So you can always call the helpline and ask to be referred to a research team member as well. Oh, and I see Dr. Novotny also put in there in the chat, the Pediatric Epilepsy Learning Healthcare System. Thank you, the PELS group. And this is another of these learning healthcare systems that are designed to bring together information from multiple centers, identify best practices, and then spread that across, you know, multiple centers. So thank you for mentioning that. I did not intend to forget them, so thank you.
Yes, thank you, Dr. Novotny. The last question is a little bit more hefty, but regarding treatments, are there different treatments that you might need to consider if you had a genetic epilepsy versus other forms? And in general, how may you find out if you have a genetic epilepsy? Say, does it require different forms of testing? And lastly, would you find it reasonable if you do have consistent seizure control to still go through that type of testing to determine if you have a genetic form?
Those are great questions. So I'll try to remember all 3 of those. So the first one was about different treatments. So there are emerging treatments that are in the pipeline of development right now that are specific for specific genetic epilepsies. So I'll give you one example, and this is an example of a company that we actually provided a grant in order to help them test their treatment in people with epilepsy. The company is called PTC Therapeutics, and their treatment is adalurin. It's a compound that helps to read through a missense mutation in the particular gene that is affected. They're testing that treatment in Dravet syndrome and in CDKL5 disorder. And in those cases, if you have that particular missense mutation or nonsense mutation, it will help read through that mistake in the genetic information and produce the correct protein. So those types of things are the treatments that companies are now thinking about in order to get much more precise intervention for those types of conditions. The second question was about testing. And the progress in testing has been much more rapid in pediatric epilepsies. And I know we have some other pediatric experts here, and I would invite them to comment as well. But what we're finding is that when children begin to have seizures, especially young children, begin to have seizures that don't have another explained cause, genetic testing is absolutely an important tool in the toolbox to understand why they are beginning to have seizures. And so it's much more common in pediatrics than it has been in adult epilepsy, but my belief is that it will become much more common in adult epilepsy as well. You know, many people began having seizures in childhood. They're now adults, and they may not have been identified when they were children because we didn't have this technology available, but they may still benefit potentially from some of the new therapies that could be coming out. And then the last question, help me remember what that last question was.
Done an excellent job thus far, Brandy. Yes, it was really specifically in the case of an individual who has reasonable seizure control, would it still be sensible to consider getting testing for genetic epilepsy to determine if that is the cause?
Thank you. So, I mean, I would say that's a question to discuss with your healthcare provider. If you have, seizure freedom, if you are completely controlled, you are not experiencing other difficult side effects, you're not having other comorbid issues that are a problem, it may not be all that important for you. It is very important when people can't find seizure control, when they've tried medication after medication and nothing seems to work. Number one, if you've not found seizure control after trying 2 anti-seizure medicines, you should be looking for that next level of epilepsy care, epilepsy specialty care. And in that case, I think genetic testing can become part of that toolkit to understand what's going on. So that would be my recommendation, is that you should talk with your healthcare provider about your individual situation.
Thank you so much. That was excellent, Brandy. Again, we truly appreciate all that information, but that is all for the questions and answers as of this now. So thank you so much again, and we'll be moving towards another SK Life Sciences video. We want to apologize for the audio earlier. Hopefully this takes care of that issue here. So thanks again, Brandy.
All right, it looks like we might be having some more technical difficulties. Sorry about that. But Brandy, thank you so much. That was such a great, interesting talk. And thank you to all our speakers and sponsors. This concludes our first ever Innovations in Epilepsy webinar series. So I just want to thank all of you again. A reminder, these were recorded and will be on YouTube shortly. And thanks again. Enjoy the rest of your weekend.